Welcome back to Madison Noteworthy Health. I'm Dr. Frank Byrne, your host, and we're here today with Dr. Travis Good, the co-founder and CEO of Catalyze. Thank you for joining us, Travis.
Thanks for having me, Frank.
Tell us a little bit about what is Catalyze, Travis.
So Catalyze is a high-trust certified HIPAA-compliant platform built specifically for healthcare technology, and we address some of the unique plumbing requirements, as we refer to them, for healthcare companies, developers, enterprises.
Where did you get the idea for Catalyze?
So we were working on a medical education startup, and so we were building mobile applications for physicians in training, medical students, residents, and academic physicians to exchange information about interesting cases and things that they were seeing on the wards. You're a physician, academic medicine, you see a lot of interesting cases. And in the process of doing that, what we discovered was in order to use modern hosted platforms, those types of technologies, and to do it in a way that complies with HIPAA, it was a black box. We were going about it and trying to figure out, the things that we needed to do to comply with these rules, which were really not written with modern technology in mind. The conclusion we came to is that there was a bigger problem that we could solve, and we could solve it for all of the people, the innovators in healthcare that are building new solutions for bundled payments or for telemedicine or for patient engagement or clinical communication. And so we built Catalyze to address that problem.
So what have you found here in the technology community in the Madison area, and why do you stay here?
Madison is a great place to build a technology company, and specifically a healthcare technology company. With University of Wisconsin, right here, there's a ton of great engineering talent. And then the additional piece is that we have this large company in Verona called Epic, and Epic is a monster of a company. And so there is a great body of talent here in the Midwest.
Would it be fair to say that we have a substantial, significant cluster of healthcare IT here, and that Epic would be the anchor tenant, if you will, or founder of that cluster?
Yeah, I think that's fair. You definitely have a cluster here of healthcare technology companies. It's actually pretty astounding. I mean, Madison is a small market compared to San Francisco or New York in terms of the overall market size. And it's hard to find a place that has this kind of concentration of healthcare technology companies. I do think that Epic plays a big role in that.
What advice would you have for an entrepreneur who's got hopes and dreams? What would you tell them, Travis, given your great experience and track record?
A couple pieces of advice that I would give. The first one, and probably the most important one, is if you're passionate about something and you believe in what you're doing, then keep doing it. Don't stop. Don't let people tell you that you can't do it. And so you have to survive in a lot of ways and just keep moving. The other thing I would say is really talk to people in the industry. So Frank, I know that we met early on. We met a couple months after Catalyze just to kind of talk to you about what we were doing. And that was really early, and we're in a different place now than where we thought we would be at that point in terms of what we were building and what we were selling and who was buying it. And the more people that you talk to, and the more you are able to come up with actions based on those conversations, I think the more successful you'll be.
So that's very interesting, Travis, because as I've spent some time in the tech community the past few years, some of the things I see that lead to people not being successful are exactly what you've talked about. For example, they have a good idea, but frankly, they don't have enough passion to make the sacrifices necessary. I mean, in your case, you had a perfectly good career trajectory as a physician with a job wherever you wanted it pretty much in emergency medicine, and yet you chose to let go of that to do this.
That's exactly it. So I agree with you completely. And there's always something that you're going to have to give up, to do it. And the other thing I'll say too is, you may have a great idea, and you may not. You can't be too married to the idea. You have to be okay that some of the things that you think are great ideas aren't going to work out. And you have to, in a way, let that feedback and let your customers and let the market help you determine what that product is.
Well, thanks for what you're doing to attract others here to our community. That's got to be great for the future of the community, Travis.
Thank you, Frank.
Travis, great to be with you today. Thank you for joining us on Madison Noteworthy Health. See you next time.